Right, in breaking news out of Geneva, on the eve of the start of the World Health Assembly, Professor Mohamed Yakub Janabi of Tanzania has been nominated as the next director of the WHO African region. The professor was today nominated during a special session of the WHO Regional Committee for Africa. This momentous milestone for Africa occurs as a high-level gathering shines a spotlight on leadership and accountability on women's, children's and adolescent health. The Lives in the Balance high-level side event saw South Africa's Health Minister, Dr. Motsaledi, deliver the keynote address. South Africa is chair of Global Leaders Network, and Dr. Motsaledi joins us now live from Geneva. Minister, very good evening to you. Thank you for your time. Let's start with the big picture. How does the voting of a new regional director for the Africa region reflect the commitment of the Global South to the challenges of the SDG 3, which affects it more than developed countries where you are at the moment?
Yes, good evening, Paul. Good evening to the listeners. I need to explain it very well because we have mentioned two things that are not necessarily related, but they took place today. Firstly, as you know, we are here at the World Health Assembly, which starts tomorrow officially. It's an annual event of all ministers of health in the whole world. And it is the decision-making body of the World Health Organization. Now, the World Health Organization is divided into 6 regions around the world. One of them is called WHO Afro, meaning the African region of the World Health Organization. It has got a regional director. Remember, the whole World Organization has got a director general who is Tedros Ghebreyesus. I'm sure you heard about him a lot during COVID. Now, each region must have a director. Now, we chose our director last year in August, as the African region holds its meetings every August, and we choose the director every 5 years. So last year, it was a time to choose for a director. A doctor from Tanzania, Dr. Ndugulile, won the appointment. He was due to start as a regional director in February this year. But in November last year, he passed away unexpectedly, a sudden illness, then he was gone. After we spent the whole day interviewing and choosing the right person. So now we were without the director on the African region. Now they said, instead of calling another conference, we wait until we come to the World Health Assembly, and the day before the World Health Assembly starts, all ministers of health in Africa need to meet to choose a new director. Now, I don't know whether it's a historical coincidence or not. Again, Tanzania again put up a candidate, and the person who won happened to be from Tanzania again, another professor from Tanzania, this time Professor Janabi. He beat a candidate from Senegal, from Guinea, from Cote d'Ivoire. Dr. Ndugulile in August, also from Tanzania, beat a candidate from Rwanda, Cote d'Ivoire, and Niger. So it looks like it's a double win for Tanzania. Yeah. They usually say lightning doesn't hit twice in the same place, but this time for Tanzania, it did. And the professor was extremely very good. He is a cardiologist by profession and very, very knowledgeable. He was the advisor of the minister of several presidents, rather, in Tanzania, starting with President Kikwete and including the present president.
Minister, what were your observations for South Africa and the continent, especially as you reflect on the state of health and hospitals and healthcare in South Africa, unemployed doctors, nurses in South Africa, and in fact, a story running this evening on the lack of senior doctors to supervise interns at some facilities. And I ask you this, I know that you delivered a keynote address titled Lives in the Balance. What were your observations for South Africa and the continent as you reflect on some of the realities here at home?
Well, unfortunately, that was not the focus. The keynote address I gave was for another meeting immediately after this selection of the professor. That meeting closed officially. It was closed officially by the Director General of the World Health Organization. I went to another meeting. This meeting is about what we call partnership for maternal, newborn, children and Adolescent Health, which is headed by the former Prime Minister of New Zealand, the Right Honourable Helen Clark. Now, this was established to deal with health of mothers, that's maternal, newborns, children, and adolescents. But it was realized that heads of states around the whole world don't seem to be taking seriously this issue of maternal, child, newborn, and adolescent health. Most because these are the most vulnerable, the poorest people. Even there, in South Africa, people who don't have medical aids are mostly women, children, adolescents, etc. And all over the world, they seem to be forgotten. So a network called Global Leaders Network was established to try and entice presidents, prime ministers, heads of states around the whole world to take interest in maternal, children, and adolescent issues as far as their health is concerned. Now, President Ramaphosa has been elected as a leader to mobilize all the world leaders. So up to so far, 11 world leaders are part of this global network. Now, today I was giving a keynote address on that side meeting of maternal, children, and women's health, and discussing exactly what is the problem with them around the world, what are we going to do to them, and mentioning, by the way, that after Trump has done what he's done, remember Trump has pulled out in everything to do with health, and it is believed that all over the world, the people who are going to suffer the most out of that withdrawal are women, newborns, children, and adolescents, and we need to discuss exactly what must happen.
What are you hoping to achieve? I mean, as you reflect on those very important topics, assessing the ripple effect and the potential danger?
Well, the assertion here was that we need to stand on our own. Firstly, heads of states need to take interest in maternal, newborn, children, and adolescent issues. They need to. Maybe I don't want to deviate, but let me just give you an example for you to understand why is it so important. In 2010, Yvonne Shaka was appointed as an ambassador for this women health, maternal, newborn, adolescent. She came to an AU meeting in Uganda where I was attending. And she came with a team to talk to head of states about these issues concerning women, adolescent, children, etc. And when they were introduced, one head of states, I won't mention his name, unfortunately he's late, may his soul rest in peace. He stood up and said, "Why do you want to waste our time? We are here on important state issues, and you want us to stop and listen to issues about breastfeeding,
My goodness.
That's how. Yes, so Yvonne Shaka being tough and sharp, he said, "Mr. President, if your mother did not breastfeed you, you would not have been a president today. So please listen to the important issues of women." So I was just giving you an example why we need a global network for heads of states to know how important is it. Because the issues of women and children is not just about health being a fundamental human right. It's about development. No country can develop, for instance, if maternal mortality is high, if the infant mortality is high, if under 5 mortality, no country can develop, because that is where life starts. Now, for heads of states around the world to regard that as something that is peripheral, as the late head of state said on the African continent, is a painful reminder that we need to do something extraordinary. And now here is an announcement being made in America, pulling out of all the health institutions, and we know people who are benefiting the most are those who are vulnerable, and they are the ones who are going to lose the most.
Absolutely. Minister, thank you so much for your time. Unfortunately, we're going to have to leave it there. South Africa's Health Minister, Dr. Motsaledi, they're speaking to us in the news coming out of Geneva on the eve of the start of the World Health Assembly. Professor Mohamed Yakub Janabi of Tanzania nominated as the next director of the WHO African region.